and welcome to Medical Dialogues. I'm Dr. Bhumika. Here's what I bring to you from the world of medicine. Link between social expectation of masculinity and treatment of CVD risks. A recent study led by researchers at the University of Chicago found that boys and men who enact behaviors more closely aligned with stereotypical gender norms in their social environment are less likely to report receiving diagnosis or treatment for cardiovascular disease risk factors. Their findings build on existing research showing that sociocultural pressures to perform male gender identity are linked to detrimental health-related behaviors, such as substance use and rejection of medical therapies and recommendations. The findings were published in JAMA Network Open. Nathaniel Glasser, MD, general internist and pediatrician at UChicago Medicine and lead author on the paper, and his colleagues analyzed data from AdHealth, a nationally representative longitudinal study that collected health measurements and survey responses from more than 12,300 people at multiple points over the course of 24 years. They quantified AdHealth participants' male gender expressivity by identifying a subset of survey questions that were answered most differently by self-identified male versus female participants, then measuring how closely male participants' answer to those questions matched those of their same-gendered peers. Zeroing in on cardiovascular disease, the researchers compared the AdHealth biological measurements with health-related survey responses to see if men with detectable risk factors like high blood pressure reported receiving diagnosis or treatment for those conditions. They found that men who showed more stereotypical gender expressions were significantly less likely to report that a healthcare professional had ever told them about certain cardiovascular disease risk conditions. Even when these men did report having previously received a diagnosis, they were still less likely to report that they were asking medication to treat these conditions. The risk factors examined in the study are all conditions that would normally be detected by screening that are part of basic primary care. It's unclear whether the decrease in reported diagnosis and treatment among those with higher male gender expression indicates that men aren't going in to get screened, that they aren't paying attention to their diagnosis even when they do get screened, or that they are simply downplaying their diagnosis when asked about them. Whatever the underlying reason, the findings highlight a missed opportunity to prevent or alleviate serious cardiovascular conditions later in life. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.